Hi, so now we will be discussing mechanism of labor in the left occipito anterior position, which is the most common position. Now, this is the skull and this is the occiput behind. This is the occiput. So, if we have to show LOA, this is how we'll show it. Left side anterior, the occiput is anterior. Now, remember when we talk about the steps of mechanism of labor, the most important thing is that descent is not a single step. It is happening throughout, and superimposed on descent are the other movements which are happening. Without descent, the fetus can't come out. So never write descent as the first point. Descent is a continuous process. It is always happening. Now when we come to the different other steps, the first is engagement. Engagement is when the largest transverse diameter of the fetus, that is the biparietal diameter, crosses the pelvic brim. So this is engagement. Next, what happens is flexion. See this movement? This is flexion. Flexion is basically reducing the AP diameter to a smaller diameter. From occipitofrontal, it becomes suboccipitobregmatic, and that enables the fetus to negotiate the bony pelvis. The next thing that happens is internal rotation. Look carefully, this is internal rotation. So basically it is twisting of the fetal skull by 45 degrees over the body of the fetus. And why this happens is because remember in our class on the pelvis is a inlet is a transverse oval, outlet is a vertical oval. So the fetus also has to negotiate its way such that it fits inside the pelvis nicely. So this is internal rotation. Then along with the rotation, descent will keep happening, and then the head crowns. So crowning, and then the head is borne by extension. See, the head comes out, the occiput hinges against the pubic symphysis, and the head is borne by extension. Now once the head is free, it will restitute, or untwisting of the neck happens. Okay, so it was twisted by 45 degrees, but once the head is free of all the bony confines of the pelvis, it will untwist, and this will appear as the fetus turning this side. This is called as restitution. And then a further twisting of 45 degrees will happen, which is called as external rotation. And why does this happen? Because now the shoulders are undergoing internal rotation. So if the shoulders move, the head will also move, and this again will happen by 45 degrees if it's LOA. So this is delivery of the head, and then the anterior shoulder is delivered, and then the posterior shoulder is delivered. So this is the mechanism of labor in left occipito anterior. Just to quickly revise, descent is a continuous process, then engagement, then flexion, then internal rotation, then the head is borne by extension, then restitution, external rotation, and delivery of the shoulders.